Okay girls, so we're doing our second electrical facial. This is high frequency, and this facial is going to be for an oily skin. This facial will dry up and emulsify pustules and comedones. It will help put a UV film on the skin which will dry out all of those skin problems that are associated with an oily skin. And because we're going to be using an oxygenated cream specifically for high frequency, that is going to heal the skin, because as we know, oxygen is good for our skin. It's going to heal the skin, and because we are going to be applying that cream with gauze, it's going to create a film. It's going to trap the ozone underneath the gauze, and instead of the ozone being dispersed into the atmosphere immediately, which is still effective but obviously nowhere near as effective, by using gauze it is going to trap the ozone underneath, and that will allow it to continue to heal and help the skin for far longer. So you are going to get a much more effective treatment by using gauze with your oxygenated cream. So I want to just go through the machine and the equipment that comes with it. So we have our machine and we have our lead, which gets plugged into the back of the machine, and that will be turned on. Now when you turn your machine on with the red on-off button, which is just here, sometimes it will say English or Spanish, and you need to choose the language, and you would just press English. The top dial is showing you the amount of minutes, and you can change that. So it's always preset on 15 minutes, and this treatment we want 15 minutes, so we will not be changing that. Then down here it's set on 1, and you would increase that according to the client's skin type. As in, is she sensitive but oily? Is she normal but oily? So that would then be affecting the amount of current that you put through your electrode. And you would obviously be increasing that according to the client's feel. So she would be telling you when she can feel any kind of sensation, and you would stop increasing that intensity button down there. Over here you have your pause and start button. That will start your clock working, and it will also start the electricity coming through the electrode. Now the electrode that covers the whole face is the mushroom, which is this one here. They are quite tight to get into the handpiece, but it fits in like this. So we have now placed on our client's skin, we've done our sensitivity test before we started the facial, as usual, thermal or tactile, and we have now done the full facial, including a steam and exfoliate, and we are going to now apply the gauze with the oxygenated cream, and we are going to start the treatment. So we're going to make sure that the machine is actually working, so we'll turn that on, and we will get the light coming through and a buzzing sound. Now remember, you must explain to your client what they should be feeling and what they should be hearing, because this sound can be a little bit disturbing to the client, but tell them that it literally is just a buzzing sound. There's no pain at all or discomfort with this treatment. It's a very relaxing treatment if you do this treatment correctly. So we know our machine is actually working. So what we would do now is we would place this on our client's forehead, and we would move the electrode, and we would go up. I'm now on 2. I'm asking my client if she can feel any kind of sensation. She's telling me that she can't, and I've given it a little while, so I know that it should be coming through by now, so I can go up 1 more. And my client tells me that that's absolutely fine, it's comfortable, and she can feel the current. So I am now, with this mushroom electrode, I am going to be covering the whole of my client's face. Now there are going to be smaller areas that I am not going to be able to reach with this mushroom. So I'm going to do as much as I can. And what you're going to be doing is checking that with the dial for the time, it goes down, that you've been doing this for no more than 10 minutes. No more than 10 minutes. Now obviously if the client's got an oily but sensitive skin, it would be less time. It would be 5 minutes. Anything between 3 and 10 minutes is appropriate for this treatment when you're working on the same area. So for us, we're going for the 10 minutes, and I am covering as much of my client's face as possible. Now, if my client was saying that it did feel comfortable, but now it's feeling a little uncomfortable, you are going to now reduce that dial until it's comfortable again. Now, when we've done our 10 minutes and that dial now says 5 instead of 15, I am going to slowly take this all the way down whilst moving my electrode. Don't keep it still, and then I can take that off. I would press my pause button, remove my mushroom electrode, and I would put my teardrop, which I call teardrop electrode, into my handheld device, and I would once again, starting on one, on the forehead, always from the forehead. It's a larger area, so if you do sway over or down or up in any way, you know that it's not going in their eye or in their mouth. So just keep that moving on the forehead because it's a larger area, and the clock is starting again. Now I know my client was comfortable on 3. I'm going to go to number 3, come round, and I'm going to do those small areas. I'm going to do the upper lip. Don't forget the upper lip. It's really important. We often forget it in a facial. You certainly don't want to forget that with this treatment. So I'm going to do the sides of the nose maybe. Maybe they've got deep creases down the side of the mouth. I can get those. They might have a deep crease in the chin. I can get that. And you may not have been able to do the actual knobbly part of the chin. So I'm going to get that as well. And any areas that we know we couldn't get with that mushroom, you might want to get slightly closer to the eye using the tip and coming around, and that's what that would be. And you do this for about 3 minutes, and we know that our clock is now going to be down to 2 minutes left. Keep that electrode moving, turn it down to 1, and then put it on pause. Okay, now that leaves us to do any areas that could not be covered with the teardrop, and it will allow us now to do our sparking. So, this particular machine comes with a ball high frequency device that's now going in, and so that you can see the areas that you want to work on. At this point you would remove your balls, place that back into the bowl, which obviously will be sanitised. The bowl will be sanitised later and the gauze will be thrown away. The gauze will have body fluid on it because of what it's drawn out and what it's absorbed, so that will go in your clinical waste. So we are now coming back to our machine. We had 2 minutes to do our sparking. Now sparking is not actually touching the skin, it's getting very, very close to the skin using this little touch method, so that a spark is created between the client's skin and the electrode. That spark will drag out any impurity. So if we've got spots, whiteheads, comedones, anything that we can see needs to be drawn out, sparking will do that. It may not do it on the first treatment, but it will start to emulsify it, break it up so that it will naturally come out on its own, because you do not want your client squeezing spots and making their skin worse and contamination and so on. So what we will do then is show you how to spark. So with sparking, you often have to go up a little bit higher. I was on 3 originally, so I'm going to go to 4 or 5. I don't want to touch my client's skin because we don't want to divert any current, but I will get as close as possible to a specific comedone or spot, and I will literally spark. Now you can do 1, 2, 3 sparks and then lift, see whether there's any reaction on the skin, come back, 1, 2, 3 sparks, 1, 2, 3 sparks. So obviously this head is not going to show you or it's not going to allow you to hear a spark, so that's what sparking will sound like. And I'm hoping the camera is picking up how I'm not actually touching the skin, I'm getting very close, and that sound is literally a spark connection between the electrode and the skin, and that's what's going to happen on your client's face. So we are now going to put the machine on pause because we've actually finished the direct high frequency, and we are going to turn it off. We will then remove the electrode because we do not want the weight of your handpiece dragging from your trolley onto the floor and smashing your electrode. So we're going to take that off, secure your handpiece. Now obviously these glass utensils are going to be in a lined bowl, something that can't tip over, something that's going to protect them. So they would be in a lined bowl, and then they're going to be cleaned with hot soapy water, dried, and then wiped over with surgical spirit, and then placed back into their box in the area that they should be allocated to. Now, that is the end of the actual high frequency treatment, the direct high frequency. What we need to do now is we need to remove that oxygenated cream. It's going to be holding impurities, body fluid, maybe some blackheads, some whiteheads may still be on the face. So we want to get that off. So a bowl of warm water, your sponges, and you are literally going to remove and wring out and remove again, and we want to make sure there's no oxygenated cream left on the face. Now the skin has gone through quite an intensive treatment, so we won't do a full facial massage. We would, however, do a form of effleurage massage for a few moments, between 3 and 5 minutes. We would remove the medium that you massaged with. You would then put your mask on according to your client's skin type, which of course in this case would have been for an oily skin. That will continue to help this specific treatment. You would remove that mask after the allocated time, tone any excess mask off the skin, and then apply the correct moisturiser for your client's skin. Now at this point we have already done electrical facials, and so we should all know that this treatment is placed into a normal level 2 facial. So you would do all the things that you would do for a level 2 facial. You would do the first cleanse, you would do your analysing, you would choose your products for that skin type. Obviously it's going to be oily in this case, and you may have done a telephone consultation to ascertain what the client's objectives are and what treatment would be best for them. So you pretty much know what products you're going to need. However, you would still analyse and you would still confirm that. Clients can often be quite confused about what their skin type is. So you would check that. Change the treatment if you needed to, if the treatment isn't correct for that client. So that level 2 facial would be done. After the treatment, you would do what you would always do. You would sit the client up, you would give them some water to hydrate, and while they're hydrating, you would go through their aftercare advice for this particular treatment, and lifestyle changes. that may be required for this particular client, and products that she should be using to help enhance and help this treatment be far more successful than it would have normally have been.